Hi everyone, my name is William Edwards and I'm here today to talk to you about a clinical syndrome known as chronic heart failure, also known as CHF. To give you a bit of an overview, the main points that I will be addressing in this PowerPoint presentation are some background information about chronic heart failure, the causes and/or symptoms of chronic heart failure, a description on the techniques used to diagnose chronic heart failure, the ways in which the results of these diagnostic tests are stratified and/or obtained, and finally, I'll be discussing several ways in which practitioners and individuals collaborate in order to manage and treat chronic heart failure. To give you a bit of an introduction to chronic heart failure and or some of the background information, the definition of chronic heart failure is controversial as it has altered over the past 40 years. Chronic heart failure, however, can be classified as a complex clinical syndrome that can occur at rest or during effort. It can result from any structural or functional cardiac disorder that impairs the ability of the ventricle to fill or eject blood, and also to maintain circulation of the blood in the tissues of the body. As seen here by figure 1, the heart failure can be divided into both the left side, which includes the left ventricle and left atrium, or the right side, which is made up of the right ventricle and atrium. Now, chronic heart failure can be due to either systolic dysfunction, which is known as the inability of the heart to contract and/or push out the blood, or chronic heart failure can be due to diastolic dysfunction, which can be noted as the heart's inability to relax. Some risk factors. Overall, chronic heart failure is present in approximately 1.5 to 2% of Australia's population, and a pattern of incidence and prevalence can be seen to rise with age. It is known as the most common reason for hospital admissions and GP consultations for individuals who are over the age of 70. Some of the more common risk factors and causes of chronic heart failure include myocardial infarction, which is commonly known as a heart attack and occurs when the blood flow stops to part of the heart, causing damage to the heart muscle. Hypertension, which can lead to left ventricular hypertrophy and makes it harder to oxygenate the heart muscles. Both diabetes and obesity can both lead to coronary artery disease, or CAD. Coronary artery disease, which happens when the arteries that supply blood to the heart muscles become hardened and narrowed. This is due to the buildup of either cholesterol and/or other material. Smoking and/or cardiac myopathy, which is also another name for heart muscle disease. This cardiac myopathy can either be dilated cardiac myopathy, hypertrophic cardiac myopathy, or restrictive cardiac myopathy. Some of the symptoms of chronic heart failure. It is important before performing any diagnostic testing or testing in general that a full medical history of the patient has been reviewed. Some of the symptoms often associated with CHF include exertional dysphonia, which is known as the shortness of breath or sensation of not getting enough air whilst performing exercise. Orthopnea, which is also the shortness of breath. However, this only occurs when lying flat and often causes people to sleep propped up or in a chair. Paroxysmal nocturnal dysphonia, which is known as the attacks of shortness of breath or coughing. Dry coughing and/or fatigue, weakness, and dizzy spells. The symptoms which are related to fluid retention or swelling are often associated with individuals who present a more advanced case of chronic heart failure. Symptom classification. There is a traditional system for symptom classification of chronic heart failure. As seen here by Table 1, according to the New York Heart Association, or the NYHA, this table shows the grading classification for individuals with chronic heart failure. The NYHA grading system has been found to be the most traditional system for CHF symptom classification, showing the different levels of classes from 1 to 4. Each practitioner may have a differing understanding or interpretation of the grades. However, it provides practitioners with the necessary information in order to prescribe, treat, and/or give exercise. The image displayed on this slide, Figure 2, shows a comparison between an individual with a normal functioning heart on the left-hand side and an individual who suffers from heart failure on the right-hand side. It can be seen that a normal heart has a standard sized ventricle, rich with oxygenated blood flowing through and around the body. The heart on the right-hand side is the chronic heart failure. However, it can be seen to have a dilated ventricle and reduced blood flow. This suggests that the heart is not able to pump out enough blood. Some diagnostic techniques of chronic heart failure. There are a number of diagnostic techniques which are implemented in order to help diagnose an individual. Prior to these diagnostic techniques, a physical examination of the patient is recommended in order to identify any potential causes and continuing evaluation of the disease condition. An investigation of patients suspected with chronic heart failure is crucial, as it will confirm the clinical diagnosis, identify a cause, and help to determine a prognosis. At minimum, an individual should have performed an electrocardiogram, also known as ECG or EKG, which is a test that checks for problems with electrical activity in your heart by displaying your electrical activity as line tracings in a paper. A chest x-ray, and/or a full blood count. Other initial diagnostic investigations include transthoracic echocardiograph, which is an ultrasound imaging scan of the heart using high-frequency sound waves. Peripheral markers, myocardial edema and viability, coronary angiograph, hyperdynamic testing, natriuretic peptides, and finally, spirometry and respiratory function testing. This flow diagram, displayed as Figure 3, was created by the National Heart Foundation of Australia as a basic diagnostic algorithm for chronic heart failure. It helps to explain and outline the steps that should be taken in order to correctly diagnose chronic heart failure within an individual and whether they require any specialist treatment or need to just proceed to treatment guidelines. This flow diagram, or Figure 4, once again is a flow chart that is according to the National Heart Foundation of Australia. This flow chart displays an advanced diagnostic treatment algorithm greater than the one shown previously, as it discusses the options for individuals who require surgical treatments. Stratifying the results. Once the results of the diagnostic tests have been finalised, a practitioner is now able to stratify and evaluate the results in order to prescribe the correct and appropriate treatments for an individual. From several studies and experiments, it can be noted that left ventricular ejection fraction, or LVEF, is a key measure of heart function in people living with chronic heart failure. LVEF is defined as a measurement of the percentage of blood leaving the left side of your heart each time it contracts. It is important that a normal LVEF should be between 55 to 70%. Individuals can often be below normal at a range of 40 to 55%. However, if a patient has an LVEF of below 40%, this is often a clear indicator and may confirm the diagnosis of heart failure or chronic heart failure. High-risk patients with chronic heart failure have an LVEF of equal to or less than 30%. Individuals with chronic heart failure who have a LVEF of less than 20% have been known to provide a strong indication and link with depression. Treatment options. There are several non-pharmacological treatment options for chronic heart failure. It is now known that according to Cora et al., that 2/3 of chronic heart failure related hospitalizations are often preventable. The following management options provide a positive effect in helping to prevent and modify risk factors associated with chronic heart failure. These often include physical activity or rehabilitation. With physical activity or rehabilitation, individuals who present a NYHA classification of level 1 or 2 are often prescribed exercise, which gradually increases from either 10 to 30 minutes of exercise most days, or if not every day of the week. Individuals who are classed in the NYHA class 3 symptom are recommended short intervals of low activity and frequent rest days in order to help improve and manage the level of chronic heart failure. Finally, those individuals who are classed in an NYHA class 4 are prescribed gradual mobilization in their daily life, or as much as chronic heart failure will allow. Other non-pharmacological treatments include nutrition, fluid management, smoking control, and education regarding the pathological and treatment of chronic heart failure, and also psychological support. As mentioned earlier, patients with an LVEF of less than 20 have been found to be often linked to depression and therefore increased mortality. The prevention and treatment of chronic heart failure can also be associated with particular pharmacological treatments. Beta blockers, which are known as any class of drug which inhibits the stimulation of adrenergic receptors responsible for increased cardiac action used to control heart rhythm. ACE inhibitors, which is a drug used to treat hypertension and chronic heart failure by relaxing blood vessels and decreasing blood volume. And finally, diuretics. Often devices are implemented for patients with a more serious case of chronic heart failure in order to provide a better quality of life. Some of the devices associated with treatment and management of chronic heart failure include pacemakers, which are often used in elderly patients to help control an abnormal heart rhythm, diventricular pacings, and implantable cardioverter defibrillator, or also known as ICDs. These are a device implanted into the chest or abdomen which are used to help treat irregular heartbeats. Finally, if the case of CHF is increasingly severe, specific surgeries may occur in order to prevent any further progression of the syndrome. To sum up, chronic heart failure is a continuing life-threatening syndrome which is characterized by declines in the left ventricular ejection fraction. Whilst the prescription of exercise from accredited exercise physiologists is not a cure, the correct and appropriate treatment by exercise can result in improvements not only for musculoskeletal and respiratory functions, but with evidence suggesting that there are benefits for the myocardium of the heart. All of the diagnostic investigations and treatment options help to reduce mortality and hospitalization of individuals with chronic heart failure. Exercise prescription should be viewed as a vital strategy to reduce and/or reverse the progression of this syndrome. Working as an accredited exercise physiologist with chronic heart failure patients. An accredited exercise physiologist, or AEP, could implement the practical application of these studies and diagnostic treatments within their clinical practice. AEPs can base several recommendations off the ACSM guidelines, in which it states that an AEP prescription for individuals with chronic heart failure could include aerobic training, resistance training, and the prescription of flexibility training. AEPs could implement the practical application of the New York Heart Association grading classification system in order to help explain the level of physical activity an individual with chronic heart failure should perform. Finally, accredited exercise physiologists could use the practical application of having a partnership with a local radiology or imaging practice in order to refer patients to gather further information about their syndrome. Whether this be through a chest x-ray or other testings, further investigation will provide necessary information in order to prescribe exercise. On-site or personal ECG machines could be another practical application that would mean patients would not have to travel in order to gather further results. This figure here, shown through figure 5, helps to show the practical application of a training guide that would aid an AEP in the prescription of exercise for individuals with chronic heart failure. This figure displays the specific class according to the New York Heart Association classification system that should be performed by each type of exercise, the frequency, intensity, and volume. All this information helps to reduce and/or reverse the progression of this syndrome.